Good morning, everybody. My name is Massimo Fumagalli. I will discuss today about chronic pain and acupuncture. I have a disclosure to do. I am the founder and shareholder of Sinomedica, a group of acupuncture clinics in Switzerland. Today I will discuss about a global problem in the world, which is chronic pain. Up to now, the most frequently used treatment for chronic pain are opioids and painkillers. Today we will discuss about how acupuncture could be an integrative, scientifically proved treatment. We'll present some new concepts like neuroplasticity, central sensitization, and how acupuncture can influence the autonomous nervous system. As we see in this slide, opioids are a very big problem worldwide. We could say there are more than 130 people a day that die in US every day of opioids overdose. In 2015, there were 8,400 people that died from overdose in Europe, from opioids overdose. Even in Switzerland is a big problem. Switzerland is the 7th largest consumer of opioids. In Switzerland, from 2008 to 2016, we went from 36 million units of opioids sold to 66 million, with an 80% increase every year. So it's a huge number. Opioid crisis is a problem, is a major issue for everybody. As we see here in this slide, the average consumption of opioid per year in Switzerland is 421 milligrams per person per inhabitant. That means almost 1.2 milligrams per day per inhabitant average, which is a huge consumption, considering that the normal doses for a chronic pain patient could go from 5 to 15 milligrams per day. So we use the opioids mainly for chronic pain. Chronic pain is a big problem. It affects 1.5 billion of people worldwide, 33% in America, but 20% in Europe as well, so it's an important part. The opioids crisis, so the treatment of chronic pain with opioids, is a problem of addiction, of overdose, of death, of high cost, is a big problem. And socioeconomic problem too. We could go now with a new definition of pain. In 2018, it was defined pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. We could, the chronic pain definition is a major and debilitating source of suffering. Chronic pain is classified into two kinds of chronic pain. It could be chronic primary pain, like fibromyalgia, non-specific lower back pain, or could be chronic secondary pain, where pain may at least initially be conceived as a symptom and is secondary to an underlying disease. Herniated disc, chronic cancer pain, neuropathic pain, post-traumatic pain. So there are many causes of secondary pain. Until now, I presented pain and opioid crisis in their actual dimension. Now let's discuss a little bit on how acupuncture could help. Acupuncture is feasible and evidence-based, is a feasible and evidence-based procedure for pain to further avoid opioid use in non-cancer patients. It has been declared recently by the NCCAOM, the National Certification Commission for Acupuncture and Oriental Medicine in America. So the sub-commission below the NIH in America that take care of alternative and complementary medicine. It has been declared that it could play an important role in the problem of chronic pain and in this opioid crisis. So it starts to be considered as a major player in the pain. Acupuncture and other systems, our medical needs and the people, they are in need of non-pharmacological and non-addictive strategies to treat chronic pain and other chronic disease. Acupuncture has a clinically relevant effect that cannot be explained only with placebo. And these are reasonable referral for patient, for doctor who like to refer patient with chronic pain and eventually opioid addiction and other situations. In a PubMed search that is here presented, we can see a big increase of publication about acupuncture and pain over the last decades. Only last year, 2020, we had 785 published articles, of which 96 random controlled trials and 55 meta-analyses. Compared with the 367 meta-analyses over the entire period of the last 70 years, it is an impressive growth of scientifically based research. We can no longer neglect the evidence-based importance of acupuncture in the treatment of pain. And all these PubMed articles shows that. Let's go a little bit deeper into how acupuncture works and the scientific basis of acupuncture in pain. There are different neurobiological models that explain how acupuncture achieves its therapeutic effect. So it's not some mystic treatment, practice of complementary and alternative medicine. It's mainly a modality of mainstream medicine. The latest evidence, scientific evidence, speaks about central sensitization as neuroplasticity, autonomic nervous system stimulation, hormonal modulation, and anti-inflammatory effect of acupuncture. We can translate the traditional and more philosophical concept of TCM into modern medicine, from yin-yang to autonomous nervous system, neuroplasticity, connective tissue mediated communication, etc. Thanks to recent research, there is evidence that acupuncture influences autonomic nervous system, stimulating parasympathetic system and creating a central modulated effect influencing the pain perception from the patient. So it's a quite complicated system. We have to start from the concept of chronic sensitization. I will read the definition because it's complex. Central sensitization is a condition of the nervous system that it is associated with the development and maintenance of chronic pain. When central sensitization occurs, the nervous system goes through a process called wind up and gets regulated in a person's state of high reactivity. Pain itself can create a situation of central sensitization. Sensitized patients are not only more sensitive to things that should hurt, but also to ordinary touch and pressure as well. The other complex, which is quite complex, is neuroplasticity. Neuroplasticity is the incredible ability of our brain to change its own electrical pathways. This changement can be influenced by the environment and could lead to overcoming pain and injuries perception. In case of chronic pain, some paradoxical pathways, which are called what we spoke before of central sensitization, are created in different areas of the brain. Acupuncture has been demonstrated to be effective in many disorders related to neuroplasticity, such as pain. Neuroplasticity could be a bridge between acupuncture and various neurological diseases. We anyway need more future fundamental research to really deeply understand how acupuncture works in this field. This recent article is an important article published in Brain, in the review Brain in 2017, and it demonstrates the influence of distal acupuncture stimulation on remodeling neuroplasticity pathways in case of pain or chronic pain due to carpal tunnel syndrome. It was a breakthrough, this article. Hereby, two recent big meta-analyses that through functional MRI shows real acupuncture effect on pain regulation. It goes, MRI measured different aspects of the brain, mainly hemodynamic responses that occur in different parts of the brain. Here there is another concept, which is the concept of pain matrix, which define, let's say, all the areas on the brain that are excited and that are activated by pain. Acupuncture, the effect of acupuncture can be explained through the stimulation of these areas. All the areas together are called pain matrix. Okay, let's don't go too deep into this part of neuroscience. Let's do some more practical aspect. In our clinical experience, we treat all kinds of chronic pain, both the primary pain, as we said before, fibromyalgia, non-specific pain, etc., and secondary pain, sciatic pain, lower back pain due to hernia, trigeminous pain, cancer pain, etc., etc. We use a system based on the long clinical experience. We use a treatment protocol for chronic pain management. Important, I think, is the long-term care for patients with chronic pain. The protocol we used consists in 10 weekly acupuncture treatment, acupuncture session. After 10 treatments, normally the pain should be, I don't know, 50–60% better in any case of pain. If we stop after 10 treatments, the pain comes back, since it's a chronic condition. So we continue and we reduce the frequency of treatment. We start to do one treatment, five treatments, once every second week. And let's say normally it should be 60, we should reach an improvement of 60–70% after these 15 treatments. If it is like that, then we go on and we keep one treatment every month, or let's say every 3 weeks, according to the situation of the patient. And this reduces in an important percentage the pain perception of the patient along the entire year, reducing also or containing the costs of the treatment. We have also analyzed some important meta-analysis about how long should be the acupuncture treatment. And to have an analgesic effect, acupuncture treatment of pain, of course, to have an analgesic effect of up to 80%, there should be at least 5 treatments. This demonstrates the important part and the need of doing a long-term treatment to take care of chronic pain. Now some important take-home messages. Chronic pain affects 1.5 billion of people worldwide. The opioid crisis, which is an important situation all over the world, it's a situation of addiction, overdose, death, high cost, lack of scientific evidence of safety. Acupuncture is emerging as an evidence-based, non-pharmaceutical and non-addictive strategy for cancer pain treatment, for non-cancer pain treatment, and for cancer pain treatment. There is growing scientific evidence on the effect of acupuncture and pain. There is promising clinical evidence for acupuncture as treatment option for chronic pain. And there is a need for more fundamental research on the exact mechanism of acupuncture, as well as clinical studies with long-term results to integrate into medicine. Thank you very much for your attention. I'm sorry for my English not exactly perfect. I have gone through the situation quickly. I thank all my staff for the help, Dr. Landgraf, Dr. Lupi for the help in preparing this presentation, and I wish you all the best.